I'm Bethany. I'm going to be recording Suki at She Tech Talk on chest and lungs. It's Saturday, October 12th, 2:04, and a 15-minute start now.
Awesome, thank you. Okay, so coming in, you can see that the patient's AAP chest diameter ratio is 1 to 2. You can see the costal angle right here. You can feel for the angle of Louis right here. That's the angle between the manubrium and the body of the sternum. The suprastitial notch is right here. These are the clavicles. The trachea is on the midline. It's not pulling to either side, so that's really good. I'm going to put this down because it's annoying. Okay. You can see that the chest wall is rising and falling symmetrically. The respirations are even. The rate is normal, and there's no use of accessory muscles, so you're not having any trouble breathing. Okay, that's good. Okay, let's see. I'm just going to feel you. If you tell me, or touch your chest, if you feel any pain, let me know. Okay, so you're feeling anything? No. Okay. The patient's, the color of the chest is appropriate for the rest of the skin tone. Matches, there's a few small freckles, but no lesions. I didn't feel any crepitus, so that's really good. I am going to turn around again, sorry. So I am going to listen to the different sounds. I'm going to be listening for resonance, and when I feel dullness, I'll know that's where the bottom of your lung is. So can you lean forward and kind of hunch your back? Okay, so I'm going to start near the apex of the lung. Okay, and when I hear it's flat, that's kind of where it ends. Okay, so I would be assessing both sides and comparing them to make sure they're symmetrical, but just for time I'm going to do the one. Can I have you lean forward again, and what I'm going to do is have you take a deep breath and hold it in. Okay, you can let it out now. Okay, so I'm going to mark that right here. Okay, and then still leaning forward with your arms out in front of you, I'm going to have you take a deep breath and let it all out. And then hold it. So I'm going to change right here. So looking at that, you can breathe again, sorry. The diaphragmatic excursion is between 3 and 5 centimeters, which is appropriate. You would do that on both sides as well, and they should be symmetrical. In athletes, it might be a little bit more because they have more of a their diaphragm will travel a little farther when they're breathing. And then on the right side, it could be higher because of the placement of the liver. So I'm just going to measure your thoracic expansion. So just take a deep breath for me. Okay, good. You can let it out. And that's appropriate for the body shape and size as well. Let's see, what else can we do today? Well, while you're facing this way, I'm going to listen to your breath sounds in the back. You can just breathe at a normal rate. Take a deep breath full through your mouth, probably to be deeper. And I'm going to listen to 10 different spots on your back, okay? Okay. 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 Sorry. Okay. Okay, and last one. Okay, good. We'll come back to more breathing in just a second. But what I was listening for is up near the top, near the apex, you'd expect to hear more bronchial sounds because that's where the bigger tubes are. In the middle, you should be hearing bronchovesicular sounds, because that's kind of where they branch off, and in the bottom of the base of the lung, it's going to be more vesicular sounds. If I heard any small popping sounds, they'd be near the base of the lungs, in the lower lobes. That's where fluid would most likely accumulate because of gravity. If I heard any louder, those would be called crackles. If I heard any of the similar sounds, but they'd be kind of louder and more popping, that would be bronchi, and those are usually associated with fluid or some sort of other accumulation in the lungs. Up here, an irregular sound that you might hear is wheezing, and that's more of a musical tone, and it is usually associated with a decreased airspace in the airway. Okay, so I'm going to listen to the sides of your lungs. So can I have you put your arms back where they were, crossed out in front? And if you just pull your elbows up a little. Okay, cool. So I'm going to start right here. Is that free from me? Great. Okay, and then the same spot on the other side. Okay, so since we're on the left side, I'm going to come forward. Good. And on the right side, I'm going to come back. Okay, and then I'm going to come right here. Good. Same spot on the other side. And then I'm going to pull it back. Were you yawning? That was a good one. And back here, so. Perfect. Okay, and I was just listening for the same sounds, just on the side, and I'm going to listen to the front as well. That's okay, can we turn around? Thank you. Okay, so the first place I'm going to look, I was poking your chest is alright, right above your clavicles at the apex of your lungs. Great. Right here. Okay. I'm going to look for your... So here's your second intercostal space. Very nice. Great. And then right here. Perfect. Okay. Can I have you face the back again real quick? Okay, so now I assess for tactile fremitus, which is just vibrations due to sounds. I should hear them more in the apex than the base. So what I'm going to do is have my hands right here, and when I move them down, can you just say 99?
Okay, 99, 99, 99, 99, 99.
Very nice. Okay. I think that's all I need to check. The rest I can just talk about. So you can put your shirt back up. Thanks. Okay. So I was assessing for vibrations, and like I said, you should feel them more near the apex than the base. If we had found any evidence of consolidation or dullness when we were percussing, you would be worried about consolidation or like accumulation of fluid or something else in the lungs. So there are a couple of other tests we could do, and again, it would be, well, I'd be listening for over kind of the bronchial area. I could have you say like E, and if there was kind of consolidation, you would hear more of an A sound. I could also be listening at the different places in your lungs, and if I was able to hear you say like 1, 2, 3 over a consolidated area, I'd be able to hear it. So those are things you shouldn't really be able to hear. And let's see, normal breath sounds. Oh, when you're percussing, not breath sounds. Normal sounds when you're percussing, the lungs should sound pretty resonant. If they're hyperresonant, that would mean they have too much air trapped in there, and you don't really want that. And if they're dull, like I said, that would be kind of evidence that there's something in there that shouldn't be there. So I think that's pretty much it. I hope. So, good.